Hello, I'm Dr. Patrick Carter. I will be talking with you today about the epidemiology of firearm injuries among children. In Module 1, we'll be discussing the epidemiology of firearm injuries among U.S. children. There are no conflicts of interest or relevant financial disclosures for this presentation. The objectives of this module are to discuss trends in national firearm injuries specifically among pediatric populations, including racial disparities among firearm injuries, as well as the importance of firearm access and safe storage in the home. Nationally, there are approximately 33,000 firearm injuries annually among adults and children. When broken down by mechanism, this is roughly 61% suicides or self-inflicted injuries, a little over a third homicides or assault-type firearm injuries, and approximately 2% unintentional firearm injuries. In this graph, we present trends in both motor vehicle crash and firearm-related injuries over time since the early 1950s. As you can see, there have been significant decreases in motor vehicle crash injury, primarily due to the presence of public health interventions, better-built vehicles, laws regarding seatbelt use, alcohol-impaired driving and distracted driving, and interventions by physicians in terms of making trauma care improved. You can also see from this graph that firearm-related injuries have increased over time without any significant reductions. In fact, in 2010, firearm-related injuries surpassed motor vehicle crash injury in 12 states. Among pediatric populations specifically, firearm-related injuries are the second leading cause of death. As opposed to adult populations, among children, homicide and firearm assault remains the single leading mechanism for firearm injury in approximately 3/4 of cases. This is followed by unintentional or accidental causes for firearm injury, and then self-inflicted or suicide cases. When we specifically look at firearm homicide, we see that the highest burden of injury is among youth populations. Here, the homicide rate is more than twice that of the overall U.S. population, and firearm violence is the second leading cause of death. There are significant health disparities regarding firearm homicides, and firearm homicide has been the leading cause of African American youth fatality for well over a decade. In fact, African American youth are 8 times more likely than Caucasian youth to be injured by a firearm. The peak incidence for firearm-related homicides is among youth and emerging adult populations. When looking at trends over time, we see that firearm-related homicide rates have increased substantially since the early 1980s. Among 15 to 19-year-olds, we've seen a 56% increase in firearm-related homicide, and among 20 to 24-year-olds who had a higher firearm homicide rate to begin with, rates have increased 27%. When compared to other countries, the U.S. has one of the highest firearm homicide rates. The firearm homicide rate among the U.S. population as a whole is almost 20 times higher than that seen among 22 other developed nations. When specifically examined among youth populations, the firearm homicide rate is almost 43 times higher than that of other developed nations. Among U.S. youth, suicide is the third leading cause of death overall, and firearms remain the most common method for completed teen suicides. In fact, firearms are implicated in 40% of suicides among children of all ages. Firearms also have the highest case fatality rate of all suicide methods and are fatal in almost 90% of cases. Handguns remain the most common type of firearm that's used in completed firearm suicides. Firearm suicides, as opposed to firearm homicides, disproportionately affect Caucasian and Native American youth populations. However, among African American youth, rates of firearm suicide have increased almost 133% since 1979, and current rates are almost equivalent to those seen among Caucasian populations in some areas of the country. Unintentional firearm fatalities represent a small proportion of the total number of firearm fatalities. However, they disproportionately impact pediatric populations. In fact, 20% of all unintentional firearm fatalities occur among children. These types of injuries often result from the inadvertent discharge of a firearm while children are playing together, and most commonly, the shooter is a family relative, often the victim's older brother. Prior research has shown that children as young as 3 or 4 years of age are old enough to pull a firearm trigger, and many, in fact in 20% of cases, the child that shot the firearm did not know that it was loaded when they found it and were playing with it. Half of all pediatric unintentional firearm injuries involve a firearm that was loaded and unlocked in the home. While school shootings gain a lot of media attention, they represent less than 1% of all firearm homicides and suicides. However, in 80% of these firearm-related incidents, the firearm was obtained from a friend or a relative. The data we've examined brings up the importance of firearm access among youth in the home. 38% of U.S. households have firearms. 50% of those households, including 40% with children, report that their firearms are stored loaded and unlocked in the home. This increases the risk for negative health outcomes. In homes with firearms, the homicide of a household member has been shown to be 3 times as likely, and firearms stored in the household increase a woman's risk for intimate partner homicide by 7 times. This also increases the risk for children witnessing violence in the household. Firearm access in the home has been shown to increase the risk for completed suicide among household members. This risk has been shown to be significant even among those without a prior psychiatric diagnosis. In fact, homes with a loaded firearm are over 9 times as likely to be the site of a suicide. Prior research has shown that adolescent suicides are often the result of impulsivity and firearm access. In 85% of these cases, the adolescent used a family member's firearm to attempt suicide, and a quarter of suicide survivors report that they had planned for less than 5 minutes, and a third report a recent crisis within the preceding 24 hours. This highlights the danger of having a firearm in the household with an impulsive teen. The epidemiological data that we've reviewed highlights the need to address the issue of firearm safety in the home. The American Academy of Pediatrics has reported that the most effective measure for the prevention of firearm-related injuries among children and adolescents is the absence of a firearm from the home. And in the cases where that is not possible, the American Academy of Pediatrics recommends physicians counsel their patients and family members regarding safe storage of firearms and firearm safety in the home. Prior research has shown that parents are receptive to discussions of the risks for firearm injury during their visits, and that anticipatory guidance regarding firearm safety is effective at both increasing safe storage as well as prompting families to get rid of firearms altogether. Hopefully, the data that we've presented on firearm injury will help guide you as you learn more about how to counsel patients and family members about safe storage in the household.